So moving on with your neurological exam, Timmy's, I'm gonna have you do a few things. So if you could please stand for me.
Sure.
I'm gonna assess for the rumbar sign, which means I'm gonna have you stand and see how your balance is. And now I'm gonna have you close your eyes. Try and stay still. There is no loss of balance, and so basically the rumbar sign is negative. Moving down to your gait, I'm gonna have you walk down right here, assessing your gait. That is gait symmetrical and steady. No loss of balance while she does that. And now I'm gonna have you walk heel to toe. So one foot in front of the other. It looks like she has no loss of balance, and she can walk in a straight line. And then I'm now gonna have you just looking this way at the wall. Touch your finger with one hand and then the other, kind of going back and forward in this motion. So movement is smooth and rapid and accurate. Now I'm gonna have you grab my hands right here and squeeze my fingers and pull back, and then I'm gonna push you. All right, very good. So hand grip is equal bilaterally. Strength is 5 out of 5. I'm gonna go ahead and check for the rebound phenomenon. So for that, I'm gonna have you take a seat again, and I'm gonna have you close your eyes, and I'm gonna have you squeeze my hands and push on me, and then back. It's a good push right there. So the rebound phenomenon is negative. So then we're gonna move on for the check for sterignosis and gastrosthesia. So I'm gonna put some objects in your hand and then tell me if you can identify them, okay? Close your eyes. And what's in your hand?
Glasses?
Yes. And then I'm gonna give you something else. It can be heavy. Can you grab this?
Cup?
Yes. Perfect. So you can open your eyes again. Actually, we're gonna check for the gastrosthesia. So I'm gonna draw something in your hand and you tell me what that is, okay?
Figure 8.
Perfect.
A straight line.
All right, very good. So for Denise, her sterignosis and her gastrosthesia test is intact. Now I'm gonna go ahead and check for your speech. So if you can repeat these words after me. You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Very good. So Denise's speech is clear. I'm gonna go ahead and assess. I'm gonna actually have you lay back down.
Okay.
And can you actually touch all the way? Touch with your foot, the shin of the opposite foot, up and down, please. Like that. And the other side. So the movement is straight, no imbalances noted, no irregular deviation to the side. I'm gonna go ahead and assess now for your reflexes, Timmy. So for that, I'm gonna grab this right here. And can I actually have you take a look straight at me? Sorry about that. And I'm gonna check for your bicep reflex at a 45-degree angle, like that. Like that. Perfect. I'm gonna go ahead and assess for your tricep reflex. Kind of let go of your arm. All right, and then the other side. Kind of let go. All right, very good. Now I'm gonna assess for the brachioradial reflex right here. One more time. Very good. I'm gonna check for your patella reflex, okay? So just kind of let go of your legs. Very good. One more time. Very good. And last but not least, I'm gonna check your Achilles tendon. So I'm gonna hold your foot right here. And I'm gonna hit the back of your foot like so. And then right here. Very good. So for Denise's reflexes, they're all 2 plus unequal bilaterally. We check the biceps, the triceps, the brachioradial reflex, patellar, and Achilles reflexes. 2 plus unequal bilaterally. We're gonna go ahead and inspect the upper and lower extremities. So it looks like Timis has a smooth skin, it's warm, pink, and dry. No swelling is noted to the lower extremities or the upper extremities. We're gonna go ahead and assess for range of motion for you. So let's go ahead and start with your shoulders, which we already did earlier, but we're gonna do a shoulder shrug. Go ahead. And that's a 5 out of 5 for resistance. And I'm gonna have you put your hands back and then lift your arms and then give yourself a hug one way, give yourself a hug the other way around. Perfect. So she has full range of motions to the shoulders. Moving down to the elbows, can you flex your elbows like so and the other way, and then put your palms up the other way around. And I'm gonna have you I'm gonna pull and you kind of hold against resistance, okay? And then I'm gonna push. Perfect. So Timis has a full range of motion to the elbows bilaterally, and resistance is 5 out of 5, or strength is 5 out of 5. Then we're gonna move down to the wrist, and then I'm gonna have you kind of just move it like so, and then turn it back in, up and down, in and out. Perfect. So she has full range of motion of the wrist. I'm gonna push against her. I'm gonna push against you, and then give me some resistance this way. Perfect. So resistance is a 5 out of 5 for the, or strength is 5 out of 5 for this wrist. Moving down to the fingers, we tested that earlier, but can you move your fingers like so, and then your toes as well? Perfect. And she has good grip strength. She can pull back as well. We're gonna check for your hips. I'm gonna have you lay back down. Okay. And I'm gonna have you lift one leg, and then lift the other, and then push one leg out to this, and then in and under or over, and then the other side as well. We're gonna go out and over. Perfect. I'm gonna have you turn or flip over to your other side, and then I'm gonna have you lift this leg back. There we go. And then the other. Okay, you can turn back around. Perfect. And then I'm gonna have you sit again. So that means has full range of motion for the hips. I'm gonna test for her strength. So go ahead and push against resistance, Timis. Perfect. And then back down. Perfect. So her hips are 5 out of 5 for strength. Moving down to the knees, Timis, I'm gonna have you extend your legs for me. Extend them, and then flex them. And then I'm gonna have you push against resistance, and then the other way around. So Timis has a full range of motion to the knees, as well as a 5 out of 5 for strength. Moving down to the ankles, I'm gonna have you back lay down, and then I'm gonna go ahead and have you pull your ankles outwards that way, like so, and then inside. Perfect. And then open down. Perfect. And then I'm gonna have you push on the gas pedal, and then push on my hands. Perfect. So Timis has a full range of motion of the ankles, and has 5 out of 5 for strength on the ankles. While you're laying down, I'm gonna go ahead and check for the Babinski reflex. So just kind of relax, and then I'm gonna go ahead and check. Very good. Very good. So Babinski reflex is negative, which is a normal findings for adults. Moving down to your capillary refill, I'm gonna check for your toes. It looks like she has some nail varnish on. Capillary refill to the toes is less than 3 seconds. And then I'm gonna look at your fingernails. Very good. Capillary refill to the nails or the fingers is brisk, less than 3 seconds. That means I'm gonna palpate for your joints, make sure you don't have any tenderness, okay? If you do, let me know. Okay, so checking on the joints in the elbow, any pain? I mean, sorry, shoulders?
No.
No. Going down to the elbows, any pain?
No.
Okay, pretty good. Looking at the hips, any pain?
No.
Okay, very good. Wrists, any pain? Move it up and down? No?
No.
Very good. Knees. And ankles. Any pain to your ankles?
No.
Perfect. So looking at Timisa's joints, head to toe, there is no tenderness to any of them. I'm gonna have you actually stand again. I'm gonna check for the range of motion of your spine. And then go ahead and go back a little, and so extend your back like so. Perfect. And then try and touch your toes. Very good. I'm gonna feel for the curvature of your spine. Timis has no curvature or abnormal curvature, so no lordosis or scoliosis noted to Timis' spine. Go ahead and stay straight. Checking for any abnormalities. Everything looks midline, no tenderness, open palpation. Her spine has full range of motion and strength as well. I'm gonna go ahead and check for your knees again. I'm gonna do a few tests, Timis, over here. Okay, perfect. And now that we're laying down again, while I was doing my assessment, abdominal assessment, I forgot to do the obturator sign. So what I'm gonna have you do is lift the right leg for me, and then put your foot inwards. Is there any pain in your belly?
No.
So that means that the obturator sign is negative. So now moving down, like I said, to the knees. We're gonna go ahead and palpate for any swelling to the patella. No swelling is noted to the patella area. No deformities are noted. We're gonna start off with the vargus valgus test. So I'm gonna have you bend your knee just a little, about a 45-degree angle, and I'm gonna push on your knee in the opposite ways, and then tell me if that hurts. Any pain?
No.
Perfect. So we're gonna go on the other side. Can you bend your other knee? I'm gonna push on that. Any pain?
No.
Perfect. So for her valgus and varus test is negative. There is no pain or no tenderness. Now we're gonna do something called the drawer test, which I'm gonna have you bend your foot like that at about a 45, and then I'm gonna put some pressure right here, and I'm gonna pull on your knee or lower portion, and then tell me if you have any pain, okay?
No.
Any pain? No? Perfect. And then I'm gonna go ahead and do the same on this side. While sitting on your foot, I'm gonna pull. Pain?
No.
Okay, very good. So her drawer sign is negative. Now I'm gonna check for the Lachman test, which is I'm gonna have you bend your knee at 45 degrees. Excuse me, and then we're gonna put your foot a little closer to your bottom. Very good. And I'm gonna pull on it from this lower area, and you tell me if that hurts, okay?
No.
No? Okay. And the other side? No. Any pain?
No.
Okay. So the Lachman test is negative. Denise, this concludes my head-to-toe assessment on you. Thank you for allowing me this opportunity.
Thank you.
And we'll see you in a later time.
Okay, thank you.
Thank you so much.